Welcome to the Community Health Worker Training, Cardiovascular Health and Diabetes. This is Mini Module 1B, Stroke Risk Factors and Warning Signs. The goals for this mini module: identify risk factors associated with stroke, understand the difference between risk factors that can be controlled and those that can't, and recognize the signs and symptoms of stroke. Understanding what the term stroke means and what causes strokes to occur is critical for us when we begin to explain this information to the people we're serving. Let's turn our focus now to those health conditions and behaviors that increase the risk for strokes, as well as building our awareness of the warning signs that can help us identify when somebody may be having a stroke. What are the major risk factors? Throughout this training, we'll be exploring some of the significant factors contributing to a person's risk for stroke. Remember that some factors are things that people can change and some things they can't change. So someone who's had a previous risk at stroke is at a higher risk of having another one. Someone with high blood pressure or heart disease. Diabetes increases somebody's risk of having a stroke, and so does smoking. When thinking about stroke risk factors, it's especially important to consider those risk factors that are within our control to manage and change. According to the CDC, these controllable risk factors increase the risk of stroke: inactivity, unhealthy eating, obesity, and stress. Inactivity. Not getting enough physical activity can lead to other health conditions that can raise the risk of having a stroke. These health conditions include obesity, high blood pressure, high cholesterol, and diabetes. Regular physical activity can lower your chances of having a stroke. Unhealthy eating. According to the CDC, diets high in saturated fats, trans fats, and cholesterol have been linked to stroke and related conditions such as heart disease. Also, high sodium or salt diets can raise blood pressure levels. Obesity. Obesity may lead to health conditions like high blood pressure and diabetes, which raises your odds of having a stroke. Obesity means having excess body fat. Obesity is linked to higher bad cholesterol and triglyceride levels and to lower good cholesterol levels. And finally, stress. The connection of stress to strokes may not be directly linked, but stress is associated with established risk factors for stroke, such as high blood pressure, obesity, and smoking. Stress eating is a common habit which can lead to obesity. Stress may also lead to poorer sleep, and if you're tired, you may be less likely to exercise. People under constant stress have higher levels of cortisol and other stress hormones, which increase the risk of high blood pressure, another risk factor for strokes. One risk factor that's not on here is cigarette smoking, just because we ran out of room, and that is certainly a controllable risk factor for stroke. Community health workers can counteract the negative effects of inactivity, unhealthy eating, obesity, and stress through supporting clients to have behavior and lifestyle changes. As we prepare to partner with individuals on their healthcare concerns, it's important for us to be able to talk about opportunities to turn risks around. So you might be thinking, what can we do about these risk factors? Well, let's take them one at a time. Exercise and physical activity. Exercise contributes to losing weight and lowering blood pressure. It also stands on its own as an independent stroke reducer. What that means is that if somebody starts to exercise, even something as simple as walking, even if they don't lose weight, the exercise alone lowers the risk of stroke. Healthy eating and diet. Eating foods low in saturated fats, trans fats, and cholesterol, and high in fiber can prevent high cholesterol. Limiting salt, sodium, in your diet can also lower your blood pressure, which again lowers the risk of stroke. Weight loss. If you're overweight, losing as little as 10 pounds can have a real impact on your stroke risk. The benefits of maintaining a healthy weight go far beyond improved energy. By losing weight or maintaining a healthy weight, you are also likely to enjoy a higher quality of life. We all know that it can be very difficult to lose weight and especially to keep it off. But one thing that's important to stress to your clients is that they don't have to get their weight into a normal range to get the benefits. So even losing as little as 10% to 15% of their weight, even if they are still obese, lowers their risk of stroke and of blood pressure, of high blood pressure. And finally, stress reduction. Mindfulness practices such as meditation and yoga can decrease the risk for heart disease and increase overall well-being. They also can decrease the risk of high blood pressure, which again is a risk factor for stroke. There are several stroke risk factors that are unavoidable. These include a history of stroke. A person who has already had a stroke or had a heart attack is at greater risk of having a second stroke. Family history. Your stroke risk is greater if a parent, grandparent, sister, or brother has had a stroke. Race and ethnicity. The risk of stroke varies with race and ethnicity. African Americans and Hispanics are more likely to have strokes than Caucasians. The risk of stroke is also higher among Native Americans and Alaskan Natives. Gender. Having a stroke is more common in men than in women. In most age groups, more men than women will have a stroke in a given year. However, women account for more than half of all stroke deaths. Women who are pregnant also have a higher stroke risk. Also at higher risk are women who both take birth control pills and smoke together, or have risk factors such as high blood pressure. And finally, age. People of all ages, including children, have strokes. However, the risk of stroke increases the older you get. This video explores some of the factors that elevate risk for stroke. Click on the link below the video picture here, and it will open the video in YouTube. Once you've watched it, close out that window to return to the PowerPoint. Conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. These conditions are known as the social determinants of health. The video we just watched reminds us of the importance of social determinants of health as we interact with our clients, and the need for community health workers to understand clients' life experiences, strengths, and needs. We know that poverty limits access to healthy foods and safer neighborhoods, and that more education is a predictor of better health. We also know that differences in health are striking in communities with poor social determinants of health, such as unstable housing, low income, unsafe neighborhoods, or substandard education. The American Stroke Association reports higher chronic health conditions such as diabetes, high blood pressure, and stroke within African American and Latinx communities, where poverty and stress are experienced at higher levels. Are social determinants of health a controllable risk factor for stroke? Well, that's a good question. Helping clients learn stress reduction techniques and identify resources for affordable, healthy food, and develop strategies for safe physical activity within their communities is one way community health workers can address social determinants of health. On another level, community health workers may decide to become advocates for the community at large, such as working towards safer housing, more green space, or healthier school lunches. So it's important for all of us, for community health workers and as well as your clients, to learn to recognize the signs of stroke and to know what to do if somebody is having any of these symptoms. What are the warning signs for a stroke? Understanding the warning signs can help you save someone's life, even your own. Not all strokes are the same, but there are some common warning signs that may suggest that somebody might be having a stroke. So take a look at this video. Again, click on the link and it'll open it for you. And before you do that, I'm going to review with you what the common warning signs are of stroke. Now, some people may have only one of these symptoms. Some people may have many of the symptoms. So number one, a sudden numbness or weakness of the face, arm, or leg, especially if it's only on one side of the body. Number two, sudden confusion, trouble speaking, or trouble understanding. Number three, sudden difficulty seeing in one or both eyes. Number four, sudden trouble walking, or dizziness, or loss of balance or coordination. And number five, a sudden headache with no known cause. So now take a look at the video. Now you can identify risk factors associated with stroke, explain the difference between risk factors that can be controlled and those that cannot, and recognize the signs and symptoms of stroke. Your next mini-module is Mini-Module 1C, Stroke Prevention, Diagnosis, and Treatment.